As more people get COVID, there's the possibility that more people will need treatment in a hospital. And there's a nationwide shortage of a COVID treatment. So each state will be rationed a certain amount per week. LEX 18 political reporter Carolina Buchek explains the numbers don't look good for Kentucky. Details in tonight's big story at 5.
Hospital beds and ICU beds continue to fill up with COVID patients. It's a dire situation, according to the state. And to make matters worse, there's now a shortage of a treatment that's used on COVID patients. So now hospitals will need to deal with that too.
I mean, that's a horrendous position to be in.
Governor Andy Beshear made it clear that Kentucky's tough hospital situation may get worse. And now doctors will have fewer tools to work with.
The federal government is now going to start rationing monoclonal antibody treatments to states.
Monoclonal antibodies have been used to successfully help COVID patients. But since COVID is surging across the country, there's not enough supply of this treatment to meet the demand. The governor says Kentucky will likely be rationed around 4,500 treatments per week. Last week alone, Kentucky hospitals used a little more than 5,000 of them. So the numbers don't match up.
We're going to be at a point within, I think, a week where there are going to be folks that want and probably need this treatment, and we are not going to have enough of it.
This situation could put doctors in a tough position.
This is when our doctors, probably for the very first time, will have to ration care and pick and choose.
So Beshear says people can't rely on monoclonal antibodies alone because there might not be enough. He says the solution is a COVID shot.
Your odds of needing this treatment if you're vaccinated are very low.
Good odds to have. In Frankfort, Carolina Buchek, LEX 18 News.